In today's episode, we'll be taking a deep dive into the master antioxidant known as glutathione and how it can support your fertility. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? In this episode, you'll discover what glutathione is, the overall benefits of this potent antioxidant, and exactly how glutathione can help you with your fertility. I'll be talking with Dr. Gina Nick, a world-renowned naturopathic physician, researcher, and formulator based in Newport Beach, California. With a dedication to holistic wellness, she's known for her expertise in treating a wide range of health concerns from autoimmune diseases to addiction recovery, anxiety, and more. So welcome, Dr. Gina. I am super excited for our conversation today, as I have not had anyone on yet specifically to talk about glutathione.
Oh, it's a pleasure to be here. Thank you for having me.
Yeah. So for any of the listeners who maybe haven't heard glutathione before, or maybe they have seen it on social media, but they really don't know what it is,
Yeah.
what is glutathione?
So glutathione it's a master antioxidant. So it helps to neutralize free radicals, toxins in your cells and render them inactive and get them out of your system as efficiently as possible. It's a combination actually of three amino acids. So it's referred to as a tripeptide. And it's found in every cell in your body. And it's one of the main detoxifying agents. It's one of the most important ways that your body takes toxins and removes them from your system. And I always say, I'm always surprised, and I didn't know a lot about glutathione until I went to medical school and used it in my practice. But I'm always surprised at how little people know about glutathione because it's so powerful. It's naturally occurring in the body. It is so needed, especially these days. And so my mission is to make glutathione a household name, right? Just like vitamin C, it's as important. It works with vitamin C. And we don't always know what the heck it is, really, to educate people on. I've coined the phrase vitamin G because it's easier to remember than glutathione. It's this long word, but it has so many beneficial roles in your body. And it's one of those things where because it's naturally occurring in the body, it's recognized, right? And your body knows what to do with it.
Mhm.
And as we're exposed, we're all hearing more and more in the media about exposure to toxins, whether it's pesticides, heavy metals, all of that. And so this is one of those things where glutathione levels go down as you're exposed to more and more toxins.
Mhm.
And there is so much research on the benefits of glutathione. There's over 100,000 clinical research studies on this one antioxidant. And that's why I'm like, okay, we need to be talking about this, especially with the subject that you're focused on, fertility. It is so important for men and women in terms of protecting the sperm and protecting the ovaries and helping to encourage a healthy pregnancy. And so, yeah, that's a quick rundown of what glutathione is, why it's important.
Yes, absolutely. I love it. And I do think it is on its way to becoming more of a household name and more commonly known as social media is one of those really nice ways that it does really help inform us and make us more aware of things like that. So I think it's beautiful that you are wanting to educate more people about it because it is so important and it does play so many important roles, beneficial roles in the body. So let's talk about that. What are some of the overall benefits of glutathione?
There's so many. It's one of those things. It's like I always equate it to something like vitamin C. Vitamin C is so essential to so many different functions in your body. And I think that's why there's so much research that's been done on this because it's so foundational and it impacts every system in your body. So if we start with the brain, there's something called neuroinflammation, inflammation in the brain that can be triggered by exposure to toxins, compromised hormone balance. There's a lot of reasons. Exposure to viruses, mold, yeast, all of those things can cause inflammation in the brain that leads to like impaired thought, cognitive decline, even things like attention deficit disorder. It plays a role with autism. It plays a role with Alzheimer's disease, Parkinson's disease. And I'm starting with the brain because your brain is most vulnerable to exposure to toxins. And one of the reasons it's so vulnerable is because the levels of glutathione in the brain get depleted rather quickly. And what's interesting is when you talk about toxins, they tend to congregate in the mitochondria of our cells, the powerhouse of our cells. So if you talk about the brain cells, that's where those free radicals that cause damage tend to hang out, right in the powerhouse of the cells. That's where glutathione is. And so as you're exposed to those toxins, your glutathione levels get depleted, and then you have issues. And so in terms of brain health, glutathione plays a major role. There's a lot of glutathione found in the liver. The liver is considered the biggest detoxification organ. And so it plays a really important role with taking toxins and converting them into a form where they can then get excreted from your body. There's this whole system called the human detoxification system that you know about, but most people don't know about. I didn't know about it until I learned about it in school, and really even not that much in school. I learned about it on my own after graduating. But there's this human detoxification system that is so critical to every function in your body. It's as important as the hormone system, the endocrine system. It's as important as the cardiovascular system. There's this human detoxification system, and it's comprised of the liver, the lymphatic system, your skin, the largest detoxification organ, your kidneys, your colon, all work together to remove toxins and protect your cells and protect your mitochondria, the powerhouse of your cells, so that you remain energized, healthy, vital, fertile, and so forth. And so, in terms of what glutathione does, it supports that whole system in the body. It helps with hormone balance. You could look at it as it relates to fertility, like bubble wrap around sperm and ovaries. It really protects your cells from damage to exposure to things that we can't all avoid. We're not all living in a bubble. It'd be a lot easier maybe if we were, I don't know. No, it wouldn't. It'd be boring. But like we are exposed to these things. It's impossible to avoid them all. There's things you can do to help, especially when you're talking about fertility. It's really important to look at things that you can do day to day to minimize exposure to toxins. But glutathione is one of those things that protects your cells from damage, from toxins. I see that as the biggest role that glutathione plays. And again, it's a combination of 3 amino acids naturally occurring in the body. You can boost glutathione levels naturally through different foods, like things like broccoli, strawberries, even pasture-raised grass-fed meat has levels of glutathione in it. But it seems that on a day-to-day basis, our levels are getting more and more depleted. And as we get older, our levels naturally decline. And low levels of glutathione are associated with infertility.
Mm-hmm.
And so that's where it's like if we're doing something daily to boost our own levels of glutathione, we're taking a real active step in protecting ourselves, all of ourselves, from harm.
Mm-hmm. It almost reminds me of magnesium, right? Magnesium is so important for so many different enzymatic reactions in the body,
Right.
and we are so easily depleted of it. Our food is already depleted of it, so we really do have to find ways to replenish our body of that. So yeah, it also reminds me of like when you said the bubble wrap, like a bouncer at a club or
Yes,
something like that. Like it's
perfect analogy.
yeah, it's just there to protect the cell. And I know that you had mentioned the brain, and the brain is so vulnerable, but also when we are under stress, especially a lot of oxidative stress and all those things, our reproduction is going to be also one of the first things that really goes on the back burner because it's not our body's priority in terms of survival. And then also when you were talking about As we age, our levels just naturally decline as well. There's a lot of women in their upper 30s, 40s who are wanting to have a baby or to have many babies. And this is really one of those antioxidants that can, one, maybe you're already depleted in, and two, your body could maybe really use those extra resources and benefits of glutathione.
Yes. Yeah. It's interesting now. IV hydration has become very popular, at least in California where I am, and in Hawaii as well, where there's these IV clinics where you can get nutrients through an IV, which can be really helpful. But if you look at most of the combinations that they have available, pre-combined IVs, glutathione is in like every one of them.
Mhm.
Have to ask why. Like because it is so crucial. And I'm not a huge fan of IV glutathione, and there's reasons for that, but it just speaks to the importance of this particular antioxidant. It impacts the immune system. So when we talk about fertility, having a balanced immune system is so important. And dealing with any autoimmune type conditions and things like Hashimoto's thyroiditis and so forth become also very important as it relates to fertility. And glutathione plays a role there as well in helping to modulate immune system function.
Mhm.
It sounds like the greatest thing since sliced bread. It's just but it's one of those things where I see as just it's not the be all end all, but it is such an important component to maintaining health and well-being during these times. And especially as we one of my patients says grows up. She's in her 80s, thriving, amazing woman, just published her second book and just got another PhD and exercises every day. She's like, Dr. Gina, don't tell me I'm getting old. I'm just growing up. So as we grow up, as women, right? And more women are looking at wanting to become pregnant at a later age. I had my daughter naturally at 39. So I get it. And I get all the angst around it and all of that. But the glutathione is super important, as well as hormone balance. And glutathione plays a role with hormone balance as well. So,
Mhm. Yeah, so let's talk about that actually. We've talked about so many of the different benefits of glutathione, but let's get a little bit more specific with fertility because I know that that's what all the listeners are here for.
yeah.
How specifically can it benefit fertility, both for males and females?
Yeah. So it protects the ovaries from oxidative stress. So it protects your ovaries from damage. One of the reasons your ovaries will have oxidative stress is because of lower levels of glutathione, because as we grow up, our levels go down. So it's just a natural thing that happens. And so that's super important. It also protects the quality of sperm. When there's oxidative stress, the quality of the sperm goes down, which can make it so that there's not a viable pregnancy, right? And so it protects the sperm, it protects the ovaries, and there's good data showing that low glutathione levels compromises fertility. And it makes sense. It just makes sense. It's really that simple. It's helping to offset oxidative stress. Oxidative stress is basically free radicals or toxins that cause damage to the mitochondria, the powerhouse of your cells. As that happens, fertility becomes compromised.
Mm-hmm.
Also, as it relates to hormone balance, glutathione is so important for hormone balance. I'm treating patients with hormone imbalances all the time, and glutathione is a really important part of my treatment plans, always. So, if oftentimes women will have a deficiency or a suboptimal level of progesterone, for example, and if I'm giving progesterone, I'm giving glutathione as well, because it helps the body to clear hormones in a healthy way to maintain hormonal balance.
Sure. Yeah, because a lot of times in women having low progesterone is a very common theme in terms of what we're seeing in the fertility space. And then also the estrogen to progesterone ratio is off. And glutathione plays a role, like you were just saying, in terms of the estrogen metabolism.
Yes. Yeah, it helps to offset the risk of estrogen dominance, which is
Mhm.
basically too much estrogen relative to progesterone. Progesterone, progestation, critical for pregnancy. Estrogen, it's interesting because there are some toxins that are xenoestrogens. So they mimic estrogen in your body. They'll actually attach to receptors in your estrogen receptors, but they're causing harm. And it's causing like a false elevation of estrogen, leading to estrogen dominance, causes inflammation, all of that. Yes, bringing the progesterone level up, super important, but also addressing those xenoestrogens that are causing an unhealthy increase in estrogen. That's affecting that balance too.
Yeah, that's a really good point to bring up, the xenoestrogens. So, are there any labs or biomarkers that can tell us if we're deficient in glutathione? Because I'm sure a lot of
Yeah,
listeners are like, "Oh, well, how do I know like what my glutathione
right.
levels are?"
I've done a deep dive on this. I've lectured on this to physicians at the American Academy of Anti-Aging Medicine over the years. There is no perfect way to test for glutathione. In my practice, I'll do a blood test. I don't know how effective it is, honestly, because glutathione is in every cell in your body. So doing a blood test will, if it's low, that's a real good indication that likely a lot of your cells are deficient in it. But there's no amazing way to test for glutathione. So I do some indirect tests. So there's a urine test testing pyroglutamate levels, and it's through an organic acids test. That's a way to measure glutathione wasting, how much your body's using up glutathione, and if it is using up too much. That's an indirect indication that, yeah, you would benefit from boosting your glutathione levels. There's also a blood test called GTT. When that level, it's a liver enzyme, when that level is high, that's a pretty good indication that your body is trying very hard to maintain glutathione levels because they're depleted.
Hmm.
So I tend to look at GTT, blood glutathione levels, and pyroglutamate levels.
Hmm.
But again, there's not like this perfect way because, again, it's like, how do you test every cell in your body to see the levels that are in your mitochondria? And then my philosophy is anytime you can find these nutrients in whole foods, that's number one. If you can eat more of the healthy organic fruits and vegetables that will naturally boost glutathione levels, especially if they're grown on soil that comes from a regenerative agriculture farm, which is hard to do all the time, that your levels may be higher. Removing exposure to toxins will help. And then to me, supplementing with a level of glutathione that kind of mimics what you would get if you were in a perfect world and your body was working efficiently, perfectly every day, and you were eating a perfect diet every day and you weren't exposed to toxins. Supplementing with that level. So I refer to it as a physiologic dose,
Hmm.
to me is a very safe and reasonable way to be proactive with protecting your cells while not giving your body too much. Because there's a whole conversation on once you start learning about glutathione, you're like, oh my gosh, I want to take this every day. I want to inject it. I want to use it all the time because it's this amazing anti-aging antioxidant. Too much isn't good either. And
Hmm.
here's why. There's two reasons. Your body has very tight regulations around the amount of glutathione it will keep. So it's under very tight homeostatic regulation with glutathione. That's number one. Also, when you introduce glutathione in the body, it eats up a lot of other nutrients to keep it in its active form. So the body is amazing in its innate wisdom and how it works. And what we know about glutathione is if you have glutathione in your cells, you're exposed to toxins, your ovaries are exposed to toxins, there's oxidative damage. Your body will use glutathione to protect those ovaries from damage. And then that glutathione converts to a form called oxidized glutathione. At that point, your body will work to recycle it to an active form again called reduced glutathione. Guess what? That requires a lot of nutrients. It requires vitamin C and zinc and B vitamins to keep it there. So when people go and they get high dose IVs of glutathione all the time, initially they might feel great, right? Because their inflammation, their brain has gone down. They're like, this is amazing for me. There's a point where there's like diminishing returns, where it doesn't work anymore. And one of the reasons is because you've depleted your body of these other essential cofactors that are necessary to keep everything in balance. So like when I go to formulate a glutathione supplement, I'm looking at providing the cofactors that your body needs to keep glutathione in its active form. I'm not introducing so much glutathione that you're actually causing harm or burdening your body more. That's the balance there.
Yeah, and I feel like that goes with just so many supplements, so many vitamins and isolation. Like we really have to think about the bigger picture in terms of supplementing and the downstream effects that it can have. So I love that you're so intentional about not having more or too much of a good thing, right? And providing those
Right.
cofactors as well. So I think that that's a perfect segue to really dive in and talk about your glutathione pixie sticks because I have so many questions as a pharmacist
Yeah.
and just as someone who's curious about taking them
Yeah.
herself and recommending them to clients and the listeners and things like that. So tell us about these glutathione pixie sticks and just all of your passion and expertise and intention that has gone into them as well.
Sure, sure. My journey with glutathione goes back several decades. I was using it in my practice. I was seeing that patients were getting really good results. I have a nephew who has autism, and I was always trying to get glutathione, and I just knew I kept telling my sister, he needs glutathione. I know. But then the liposomal form, which was considered the only oral form that actually got into your cells, where there's, this, it's actually a myth, but that all oral glutathione doesn't work. You have to inject it in order for it to work. That's not true. But there's a liposomal form that's effective, but it doesn't taste good. And then oftentimes you have to refrigerate it. And so it was a major barrier there. And then I didn't want to inject my little nephew, right? So I didn't want to do that. And started then, and I kept pondering, how do we get glutathione to kids and adults in a way that it's easily accessible, tastes good? Because I'm a doctor, I'm like in practice, seeing patients day in and day out. So I'm not just a formulator who's geeking out on the research. I want to actually take that research and actually turn it into a form where it's going to be useful for people at the end of the day, where they'll actually take it and they'll get the benefits. And so it was during COVID. I was homeschooling my daughter. I was looking at her. I'm like, how do I get glutathione into her and her friends, right? Let alone the moms and the dads out there. And I was like, you know what? I want to make it like candy, where it tastes like candy, looks a little bit like candy, but actually is causing benefit to the body versus harm. And so that's where this kind of came to be. And I've been formulating products forever. It's just what I love to do. And I put a formula together. I sent it off to the lab. I got back the first sample and it was like amazing off the bat. It was just like perfect. And I saw that my daughter loved it, her friends loved it, the neighbors loved it. And I was like, okay, this is something real. And I used a form of glutathione that is clinically proven to boost blood levels, to boost RBC levels. And the only reason I knew about it was because I was hired by the company who makes glutathione in this form to research it in my practice and to speak about it, or I probably wouldn't have even known about it, let alone done all the research. So that I feel like this was divinely inspired, this whole process. But that's the pixie stick. So there's no sugar, sweetened with glycine, which is one of the amino acids found in glutathione. So it helps to boost levels that way. There's a little bit of stevia in it. And other than that, it's just the cofactors, the things the body uses to maintain reduced levels of glutathione in a convenient pixie stick. So you can put it in water. I'll take it directly. I just like taking it on the tongue. And that's what they are. Yeah.
And they have other vitamins in there as well. And those were
Yeah.
the cofactors that you were talking about.
Yes. And this formula originally, it was I really wanted to help with boosting immune function and supporting detoxification. But it also has the cofactors that the body uses to maintain reduced levels. So it has things like magnesium glycinate, zinc, vitamin D3, and the doses are really important. So I didn't just put in ingredients so I could have it on the label. It drives me nuts when you see these products that have all these amazing ingredients, but there's 2 milligrams of each ingredient. But people don't realize it's not going to do anything at that dose. So using doses that are not too high, not too low, but supporting balance in the body. So things like vitamin D3, glycine, magnesium glycinate, which is a pretty high quality form of magnesium, zinc. And so it's kind of a well-rounded glutathione formula that supports immune function, protects cells from oxidative stress, helps to lower neuroinflammation, and just support overall health and well-being in kids and adults. So I designed them to be good for children as well as adults. But with women who are pregnant, I always say anytime you're considering any supplement, always work with a qualified healthcare practitioner who understands nutritional supplements truly so that they can guide you on whether it's safe or not for you personally to take. Everybody is different, everybody's unique. But the dosages I use are dosages that are found in quality foods and dosages that are found naturally in the body to help offset any potential risk of taking the supplement.
Beautiful. Yeah. So there will be a link in the show notes to check that out. So to be sure to check that out. I definitely am going to myself. I feel like with school, just going back into session, it sounds like the perfect immunity support to add on to there. And so I love to end the episodes, Dr. Gina, with 3 simple action steps you would like to leave with the listeners.
3. So the first one would be do something daily to support your human detoxification system. So that can be taking a supplement like, of course, I'm biased, but the vitamin G glutathione pixie sticks. It could be deciding to not use plastic water bottles at home to minimize exposure to the toxins from the plastic. It could be choosing to exercise for 15 minutes out in nature to support detoxification and balance cortisol levels. I'll make that number 2, actually. So, number 1 would be take a daily action to support your human detoxification system, avoiding toxins and taking something to support detoxification. Number 2 would be spending time out in nature, listening to the sounds of nature. So, not with AirPods on or headphones on, but actually being out in nature. It can be as little as 15 minutes, ideally 2 hours, because that helps to regulate your stress hormones, cortisol, which is central to all your other hormones. It's one of the best ways to regulate your stress response is just get out in nature, any kind of nature. That would be number 2. And then number 3 would be as best you can to prioritize sleep. So take the time, do a digital detox. So shut those phones off, put them away, get them away from if you can keep them out of your bedroom. If you believe in using EMF blockers, do that too. But just prioritize healthy sleep. And that involves, like I said, shutting those phones off, putting them away, and allowing yourself to go to sleep in a nice, peaceful way, because so much healing happens while you're sleeping.
Beautiful. And all of those are just so supportive of your fertility as well. So let the listeners know where they can find you, learn more, and connect with you.
Sure. If you're interested in the vitamin G glutathione pixie sticks, you can go to bestdailyever.com or vitaming.com. Those are the 2 options there. bestdailyever.com or vitaming.com. For my personal practice, it's just drgina.com, drgina.com.
Awesome. Thank you so much. This was a really fun and informative episode. And just, I think it's a really nice action step and awareness around something else that we can really do to support our fertility, but not just fertility, our immune health, our brain health, like just so many benefits in the body. So thank you so much.
Oh, it's my pleasure. Hopefully it keeps it simple because there's so much information out there. And I think a lot of people are overwhelmed these days with all of the wellness influencers and all the information online. So I'm hoping to keep the message simple and straightforward and doable.
Are you ready to finally discover why you haven't been able to get or stay pregnant? The Ultimate Fertility Blueprint is a quick, insightful quiz designed to reveal your overall capacity to conceive and help you discover potential root causes and areas to address to improve your fertility so you can finally get and stay pregnant. You'll find the link in the show notes. As a quick reminder and disclaimer, this podcast is for educational purposes only and is not a substitute for medical advice. Always consult your doctor or healthcare provider before starting any new supplement or protocol, especially if you're actively trying to conceive or undergoing treatment.